Hello guys, this is Indian Medico, and in this video we are going to see about Bennett's fracture dislocation. This is a concise presentation for medical students. Bennett's fracture is named after Irish surgeon Dr. Bennett. It is basically fracture plus dislocation of metacarpal bone at the base of the thumb. It is defined as an oblique intra-articular fracture of the base of the first metacarpal with subluxation or dislocation of the metacarpal. This picture shows the first metacarpal. As you can see, Bennett's fracture is an oblique intra-articular fracture of the base of the first metacarpal with dislocation of the metacarpal. This picture shows the X-ray of normal wrist. This picture shows Bennett's fracture. As you can see, Bennett's fracture is an oblique intra-articular fracture of the base of the first metacarpal with dislocation of the metacarpal. What is the cause of Bennett's fracture? Bennett's fracture is caused due to a longitudinal force applied to the thumb. Bennett's fracture can result when a person punches a hard object. Let us see about the symptoms of Bennett's fracture. Bennett's fracture will cause instability of carpometacarpal joint of thumb, leading to pain and weakness of pincer grasp. What are the signs of Bennett's fracture? There will be tenderness, swelling, and ecchymosis over the carpometacarpal joint of the thumb. How do you diagnose a case of Bennett's fracture? Bennett's fracture is diagnosed using X-ray. This picture shows the X-ray of a patient with Bennett's fracture. How do you treat a case of Bennett's fracture? Closed reduction and percutaneous K-wire fixation under an image intensifier is the treatment of choice for Bennett's fracture. Open reduction and internal fixation with a K-wire or a screw may be necessary in some cases. Remember, accurate reduction and a restoration of smooth joint surface is important. This is because Bennett's fracture is an intra-articular fracture. So, if it is not reduced accurately, it will lead to incongruity of the articular surfaces. This will increase the chance of developing osteoarthritis. This picture shows the repair of Bennett's fracture. Remember, the treatment of choice is closed reduction and percutaneous K-wire fixation under an image intensifier. The K-wire is incorporated in a plaster cast. A screw may also be used. This picture shows X-ray of a corrected Bennett's fracture. As you can see, percutaneous K-wire fixation is done in this case. What are the complications of Bennett's fracture? If Bennett's fracture is not treated properly, it can lead to osteoarthritis. Osteoarthritis develops if the joint surface is left irregular. It will lead to persistent pain, loss of grip. For painful osteoarthritis, excision of trapezium may be necessary. If you have any suggestions, please let me know in the comment section. If you like this video, please like, share, subscribe, and tell your friends about this channel. Please check out my playlists for more videos like this. Thank you.